Hey folks, Andrew here from Bluepoint, and today we're just going to show you some tips on how to get used to PAP therapy. So, a common issue that PAP users have, and especially people just starting out with therapy, is that it's a little hard to breathe, it's a little hard to exhale. So, we'll be going over some tips to help you fall asleep with the machine and get used to PAP therapy. Now keep in mind that the air pressure going through that machine is meant to keep your airway open at night, so you don't necessarily need that pressure just when you're about to go to bed. Now, to start, most machines have a set air pressure, but usually your device can ramp up to the pressure. Alright, so what we have here is the Respironics DreamStation machine, and the ramp button is located on top of this device. If you can see there, that little button right there that looks like a triangle, really it looks like a ramp. When you press that, let me turn it on first, and I'll cover the exhaust so it doesn't make a lot of noise. On the screen you should see a 10 on there, so that's the prescribed setting. Some of you may have a different setting, obviously, but if I press the ramp button, it goes down to 4. So your provider may have it a little higher than 4, but generally speaking, the ramp button just brings down the amount of air pressure going through your mask. Now that you've pressed the ramp button, the machine will start picking up in the air pressure and slowly climb. It will ramp up over a period of time, in about a half hour or so. The goal of ramp is to start you off at night with the air pressure at a low level so you can fall asleep easier. By the time you're deep asleep, when you need that pressure most to keep your airway open, it would have climbed up already to where you need it to be. So press that ramp button when you're just starting your night. Okay, so this is the Respironics System 1 machine, and over here that's the ramp button. So let's go ahead and press therapy on here. Now, when I press the ramp button, it should start it off at 4. Okay, what we have here is the ResMed AirSense machine. Now, when I turn it on, some of you may already have the ramp turned on. So, let me explain. Once you turn it off, just click the home menu right here, and you'll reach the home screen. Take this dial and make sure options is highlighted, turn that on, and you will see ramp time just under there. Scroll down and click one more time, and this is how you get to the ramp menu on your machine. Usually you can just leave it at automatic. Now what this device will do at automatic is that it will wait for you to fall asleep. It will actually measure that by how you're breathing, and once you fall asleep it will start ramping back up. If you can change that manually if you want. If we set it at 30 minutes, when you turn it on, it will immediately start down on that timer for 30 minutes. And it will take 30 minutes for it to start ramping from 4 all the way to however high you want it to be on. Keep in mind that your doctor prescribed you to use a PAP machine to treat your apnea, so it would benefit you to practice and train to use the machine even when you're not sleeping. If you're not particularly busy or you have a couple hours of free time during the day, just put the mask on and practice breathing with the machine turned on. Put something on the TV and just watch for an hour or half hour or 2. Really, it's up to you. The more you practice, the easier it is for you in the long run, and the faster you'll see the results of being under PAP therapy. Now, if you can't watch any TV because you need glasses and your mask is in the way, try listening to the radio, a podcast, or even an audiobook. Distract yourself and try not to pay attention to the mask. Just relax and try to